hello, and welcome back to IVF in Your Pocket, your waiting room companion. In today's episode, I'm joined again by Dr. Diana Kayal. She is here to tell us now all about transfers. She's going to answer basic questions that come up that everyone typically has about transfers. So we're so thrilled to have her back. Dr. Kyle, can you just say a little bit more about you for the listeners as a little refresh from last week's episode or those who are just tuning in now?
Hello, hello. Thank you for having me again on your show. And I'm still Dr. Diana Kayal. I am here working in the United Emirates, Arab Emirates, in the Emirate of Dubai. I've been in the UAE since 2012, founded several IVF clinics here, and I'm very happy to be talking to you about a subject that is very close to my heart, the embryo transfer.
Mm. Well, thank you so much for being here. For our listeners, if you didn't hear Dr. Kyle talk about retrieval, it's really an important episode. She talks about essential need to know facts about retrieval. So go ahead and check that out. And Dr. Kyle, tell us a little bit more about the transfer process. Specifically, I think a question that comes up around the embryo, like once the embryo is transferred, does that mean a person's pregnant?
Most patients think that once I've transferred an embryo, that they're going to get pregnant. Unfortunately, this is absolutely not true. What we do is we deposit the embryo in the middle of the uterine cavity under ultrasound guidance. Now, once we put the embryo in the uterus, there is what we call the crosstalk between the embryo and the endometrium, the lining of the uterus. So the embryo has to stick to the endometrium, to the uterine lining. Then it has to dig a hole to embed in it
Mm,
and
mm.
then for grow and become a pregnancy. So not all transfers will generate a pregnancy. And if we are transferring genetically tested embryos, pregnancy rates should be around 60% per transfer.
Mm, that is an important statistic to have in mind that with the genetic testing of a euploid that we have about a 60% chance and that it doesn't always work. So a lot of people that I see in my practice, they come in and they're surprised, I think, a lot of them, that they're up against loss. So I think kind of knowing what you just said, like going into it a little bit more educated and informed is potentially really helpful for one's mental health.
It is very important to clarify everything to patients prior to starting the treatment. We always tell them to have hope, but I always say also at the same time, keep your expectations reasonable.
Yes, yes, great advice. The other question that comes up, I think, constantly, that I'm sure you hear all the time is, does transferring two embryos double your chances of getting pregnant?
Dual embryo transfers are not recommended, or I in particular do not recommend them at all because one, they do not increase your chances of getting pregnant, particularly that we are transferring euploid embryos, normal embryos that have a high potential of implantation. So when we transfer two, there is a high risk of twin gestation. And people look and say, oh, twin pregnancies are cute. They're
Mm,
nice.
mm,
Uh, they might be cute, but they carry very high risks, both for the mother
yes,
and for the babies.
absolutely.
So, yeah.
That's great. Yeah, I think most clinics here in the US, particularly in the Bay Area, I don't think any RE that I know here in the Bay Area will transfer to euploids. Absolutely not. It's a
Yeah.
single embryo transfer. I think that's the ASRM recommendation. So,
That is the trend nowadays is
yeah.
to do an elective single embryo transfer of an euploid embryo, one baby at a time.
Yes, I like that. One baby at a time. Yes. Okay. And then another one that comes up for people who are, I think, starting the journey and a little unclear about frozen embryo transfer and this idea of a frozen embryo. Are frozen embryos weaker than like a fresh embryo?
No, pregnancy rates of frozen embryo transfers are equal, if not superior, to fresh transfers. So the frozen performs better because the environment is less stressed, the uterus is more receptive. Recent data shows that, as I said previously, most of the clinics don't do fresh transfers anymore.
Yes.
And in particular, because we are doing more and more genetic testing. If we're testing the embryos, there is no way to do a fresh transfer. We have to freeze the embryos and transfer them in a subsequent cycle.
Yes, absolutely. Um, and then a huge one that comes up about recovery after transfer, although I know it's a very quick procedure. Should I be on bed rest after transfer? Or, is resting gonna help the implantation rate?
Bed rest after embryo transfer is something that is not recommended at all. Basically, there are studies that have proven that taking rest or staying in bed will reduce the implantation rates. It will be having a detrimental effect on the embryo transfer. I don't know why people think that lying down is going to increase their chances of getting pregnant. And they have to carry on living their lives normally. And I
Yeah.
managed to convince people that it is true by telling them how it happens in normal pregnancies.
Right.
When we put the embryo back to the uterus, this is exactly like when the patient has ovulated, the egg has fertilized and is going to implant. And the patient is living her life normally and doesn't even know that she's pregnant, and she's going to work and she's going to the gym and horseback riding and you name it. And then she has a delayed period test and she is pregnant. So, what is different in IVF? Nothing. It's just the embryo has to crosstalk with the uterine lining, and lying in bed is not going to change the effect on implantation rates at all.
That's great. Another relieving fact. So, listeners, feel free to go about your normal routine. It is essential. It is really important not to put your life on hold, particularly any kind of movement.
So basically, when we do the egg retrieval, we said take 1 day rest. When
Mm,
you do the embryo transfer, you can come to the clinic, have your embryo transfer, and just go back to work.
yes, great.
Resume your life normally. There is not even a need for a day off work.
Yeah, excellent. Wonderful. And then finally, the last question here, that's an important one. If the first transfer, IVF transfer fails, does this mean that IVF will not work?
No, one failed embryo transfer doesn't mean that you're not gonna get pregnant at all. Unfortunately, it's statistics, and we said that pregnancy rates of opioid transfers is about 60%. So every time you try to get pregnant, every time you transfer an embryo, you have a 60% chance of getting pregnant. So each time it is the same chance. But the more I try, the more chances of getting pregnant. And one analogy I use to clarify it to patients is when I'm throwing the dice, what are my chances of hitting the number six? It's
Mm,
1 in 6. Every time I throw a dice, it's 1 in 6. So when I transfer an embryo, every time I put back an embryo, it's 60% chances of getting pregnant. I could be very lucky and be in the 60% group that gets pregnant from the first time, but it might take me 2, 3 trials to get pregnant. But most people will get pregnant at the second or at the third transfer.
that's
And this is what we call the cumulative pregnancy rate. So the more I try, the more chances I have of getting pregnant.
That is an important thing to know, I think, up front, so a really important thing to know going into IVF, I think, is what you just said, that it might take multiple tries. If it doesn't work on the first try, it doesn't mean it's not going to work for you. Dr. Diana Kala, we're so grateful for your expertise in answering these really fundamental questions. Thank you so much for joining us on the show.
Thank you for having me.
You can find out more about Dr. Kayal in the show notes. She brings so much knowledge to the IVF community. globally, internationally, and is quite the resource for our field. If you want to know more about me, you can find my website and email in the show notes. And then you can also find my new IVF prep workshop. And this workshop is really for people wanting clarity and less overwhelm through the IVF journey. I walk you through each step of the journey, giving lots of tips, tons of tips, mantras, some little reflection exercises and meditations. It is a great guide and tool, and I highly recommend you check that out. The link to buying that is in the show notes. And remember, until next time, you are not alone.